Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing a very short topic or a short question that you get in your Vivas, and that is what is the paradise criteria for tonsillectomy? You can also now purchase my notes. I have added links in the description. So, the most common indication for tonsillectomy is when there is recurrent tonsillitis or recurrent cases of sore throat. Now, in this case, is where the paradise criteria comes in handy. So, how will we determine how many sore throat episodes are required and what is a sore throat episode when a patient comes to you and says, like, hey, I've had like 6 episodes of sore throat. Can you perform tonsillectomy in my child? Like, how do you decide whether which patient to take up for tonsillectomy? So, the paradise criteria states that a child is eligible for tonsillectomy if they have had a minimum frequency of sore throat episodes. Now let's discuss what is a minimum frequency looks like. More than equal to 7 episodes in the past 1 year or more than equal to 5 episodes per year for the past 2 years or more than equal to 3 episodes for the past 3 years. So this is the minimum frequency of sore throat episodes that the patient has to present with. Now, the next question arises is how do you define a sore throat episodes? If a patient just comes to you and tells you that, hey, I have had 7 cases in the last 1 year, will you just perform the surgery in that case? Or what would you ask? So, each of this episode has to be documented, and this has to include sore throat and one or more of the following 4 features. The first one is either the patient has fever more than equal to 38.3 degrees Celsius or 101 degree Fahrenheit, or the patient has cervical lymphadenopathy, which is tender or enlarged more than equal to 2 centimeter, or there is presence of tonsillar exudate, or there is a positive group A streptococcal culture. This is how each sore throat episode has to be documented for it to classify under the paradise criteria for tonsillectomy. For more indications on tonsillectomy, you can check out my separate video on this. And if you have any further questions on this, please note them down in the comment section and I'll get back to you.